Restrain him pretty consistently. He just doesn't, he's not able to stop.
A family in distress, a mental health system without answers, is the only option waiting for disaster.
Tonight, our ongoing investigation of Michigan's mental health system is zeroing in on the fight to save a little boy's life.
The only father he's ever known says he has nowhere else to turn, and 7 Action News reporter Anne-Marie LaFlame has his desperate plea for help.
My son has special needs. He was born this way. He didn't ask to live this way.
These are the daily struggles the Holman family faces. Doug says his 7-year-old son, Christian, attacks him daily, and the black eyes and scratches are just the beginning.
Locks on all the cupboards, removing the knobs on the stove so he couldn't turn it on. No lighters around, no matches around, nothing flammable.
Still, Doug says Christian burned down their last home, has stabbed the dog, and threatened to do even worse.
I have to restrain him pretty consistently. He just doesn't, he's not able to stop.
He gave us documents showing while pregnant, Christian's mother drank a fifth a day, smoked cigarettes and crack, used heroin, and took lots of pills.
His biological mother is now deceased from an drug overdose.
Doug knew Christian's mother and wanted him to have a better life. So he put his name on the birth certificate, though he's not his biological father, and has worked for the past 7 years to give him all the help he possibly could.
Physical therapy, occupational therapy, behavioral therapy, sensory therapy, in-home supports.
3-on-1 schooling and a caretaker who is with Christian every minute he's not at school. Still, Doug says the violence has become too much.
I'm asking for a residential placement. When I say residential, I'm not looking for hospitalization. I'm not looking for a psychiatric hospital. I'm looking for my son to be able to go into a group home that is set up specifically for the neurological reparative therapy that he needs.
But he says he's been told time and time again, Christian's too young, too violent, too cognitively damaged.
Medicaid is a medical model, so they want a fix. Well, there is no fix for this. This young man is going to be this way. So how do we give him help that's supported?
It's a struggle executive director of Macomb ARC, Lisa Lapine, says she's seen.
The mental health system is structured in such a way that we deliver services in the home for the student or the individual and their family to try to wrap those supports around to make sure that we can keep that child in that home for as long as we possibly can.
She says though there are tens of thousands of dollars being poured into treatment for Christian every month, what Doug and other families in the same situation are looking for still comes down to funding.
Right now, there is nothing in Michigan that addresses that 18 and younger population when the home is no longer safe for the other individuals living there.
Doug says he's been told if he leaves Christian at a hospital for more intensive care, he'll be put into the foster system.
I don't know how them stars lined up, but they did. And I fought tooth and nail for him. And he's my son. He's my son. I love him.
But for now, he's living in fear, trapped in his home, afraid it's only going to get much worse before someone finally hears his family's cries for help.
Does he have to kill somebody? Does he have to kill an animal? Does he have to run outside the home and get run over by a car?
In our weeks of reaching out to community mental health in the governor's office, Christian was just brought to a mental health facility for an evaluation. Doug calls it a start, but vows to keep fighting for his son and the other children whose families have nowhere to turn. I'm Anne-Marie LaFlame, 7 Action News.